Sleep apnea is the cessation of breathing while sleeping. We see this in children and in adults. Most of the time in children we'll see hypertrophic adenoids and tonsils, large adenoids and tonsils, and surgical intervention in these kids leads to symptomatic relief. Sleep studies have not always been done in this population, so actual cure has been by observation alone. Now that we're doing more sleep studies, we are seeing some benefit to surgical intervention, but some children may need more intervention for their sleep apnea. In adults, we find that sleep apnea is more multifocal in its cause. In the past, we used to perform a surgery, uvulopalatopharyngoplasty, and what we found was that with this surgery, you had to be very particular with your patient selection, because since sleep apnea is a multifocal disease, if your problem is at your tongue base, uvulopalatopharyngoplasty won't give you benefit. Positive airway pressure, BiPAP, CPAP is still the gold standard. And when we have patients who have obstructive sleep apnea or are worrisome for obstructive sleep apnea, we usually will order a polysomnogram, and if this is positive, recommend that they undergo CPAP. For those patients that are unable to tolerate the CPAP, and unfortunately this is a significant population, surgery is an option. Surgery for these patients usually comes in 3 different types: Tier 1, Tier 2, and Tier 3 surgery. Tier 1 surgery including nasal surgery or septoplasty, inferior turbinate reduction, as well as palate surgery, uvulopalatopharyngoplasty. Tier 2 surgery, which is not as common anymore as it used to be, includes hyoid suspension and genioglossus advancement. This allows for the larynx to be suspended anteriorly so that there's less collapse at the level of the voice box, as well as at the level of the base of tongue. And the third tier includes fracture of the jaw and advancement. And this works well for patients, however, it is quite invasive. For the most part, after encouraging patients to tolerate CPAP, if they fail this, we'll go on to Tier 1 surgery first, and then repeat a sleep study in approximately 6 months to see if they're improved.